Intrauterine devices, commonly known as IUDs, are among the most effective forms of reversible contraception available today. With a success rate of over 99%, minimal maintenance, and long-lasting protection, IUDs have become an increasingly popular choice for women worldwide. However, the process of IUD insertion can seem daunting to those unfamiliar with what to expect. In this in-depth step-by-step guide, we'll walk through the preparation, procedure, and aftercare of IUD insertion, drawing on the expertise of experienced OB/GYNs to provide a clear and reassuring overview. Before an IUD is placed, there are a few important steps to ensure both safety and comfort. The first step is a thorough consultation with a healthcare provider. During this visit, the patient's medical history is reviewed, including any previous pregnancies, gynecological surgeries, and current health conditions. The provider will discuss the different types of IUDs available, namely hormonal and copper, and help select the most suitable option based on lifestyle, menstrual preferences, and individual health needs. Once an IUD has been chosen, the best time for insertion is often during the menstrual cycle period, as the cervix is naturally softer and slightly dilated, which can make the procedure more comfortable. However, IUDs can be inserted at most times during the menstrual cycle, provided pregnancy is reasonably excluded. On the day of the procedure, the patient is encouraged to eat a light meal and take an over-the-counter pain reliever, such as ibuprofen, about an hour before the appointment. This can help minimize uterine cramping during and after insertion. It's also important to arrange transportation home, as some women may feel lightheaded or crampy immediately following the procedure. Upon arrival, the patient is greeted and escorted to a private exam room. The provider explains the procedure in detail, answers any last-minute questions, and obtains informed consent. Privacy, respect, and patient comfort are prioritized throughout. The actual insertion procedure begins with the patient lying on an exam table, feet placed in stirrups, similar to a routine pelvic exam. A sheet is draped over the patient's lower body to maintain modesty. The provider then gently inserts a speculum into the vagina to visualize the cervix. This may feel a bit cool or uncomfortable, but it should not be painful. The cervix and vagina are cleansed with an antiseptic solution to reduce the risk of infection. Next, the provider may apply a local anesthetic to the cervix to help numb the area and minimize discomfort, especially if the patient is particularly sensitive or anxious. To assess the size and position of the uterus, the provider uses a slender instrument called a sound. This is gently inserted through the cervical canal into the uterus to measure its depth, ensuring that the IUD will be placed correctly and safely. Most uteri measure between 6 and 9 centimeters in length. A uterine sound can cause brief, crampy sensations similar to menstrual cramps, but the discomfort typically subsides quickly. Once the uterine depth is established, the IUD is prepared for insertion. The device, a small T-shaped piece of flexible plastic, either coated with copper or containing a slow-release hormone, is loaded into a thin, sterile inserter tube. The tube keeps the arms of the IUD folded down for smooth passage through the cervix. With the uterus measured and the IUD ready, the provider gently advances the inserter tube through the cervical canal and into the uterine cavity. Once the correct depth is reached, the plunger on the inserter is slowly withdrawn, releasing the IUD. The arms of the device spring open, anchoring it in place at the top of the uterus. This part of the procedure may cause a few seconds of intense cramping, but the sensation usually fades rapidly. After the IUD is in position, the provider carefully removes the inserter tube, leaving 2 thin strings extending from the cervix into the upper vagina. These strings are trimmed to about 2 to 3 centimeters in length, just long enough for the patient or provider to check for the IUD's presence later, but short enough not to cause discomfort during daily activities or intercourse. The speculum is removed, and the patient is allowed to rest for a few moments. The provider discusses aftercare instructions, what to expect in the hours and days following insertion, and signs of potential complications. Most women experience some mild to moderate cramping and spotting after IUD insertion. These symptoms are typically short-lived, resolving within a few hours to a couple of days. Over-the-counter pain relievers, such as ibuprofen, and a heating pad can ease discomfort. Light activity is fine, but strenuous exercise should be avoided for the rest of the day. It's normal to notice some changes in menstrual patterns after IUD placement, depending on the type used. Copper IUDs may cause heavier, longer periods and more cramping, especially in the first few cycles. Hormonal IUDs, on the other hand, often result in lighter periods, and some women eventually stop menstruating altogether. Both effects are generally harmless and reflect the mechanism by which the IUD works. It's important to monitor for signs of complications after IUD insertion, though these are rare. Warning signs include severe abdominal pain, heavy or prolonged bleeding, fever, foul-smelling vaginal discharge, or signs of infection. If any of these occur, it's essential to contact a healthcare provider promptly. The IUD's strings can be checked periodically by the patient herself, usually once a month after menstruation. This can be done by gently inserting a clean finger into the vagina to feel for the threads near the cervix. If the strings cannot be felt, or if they seem significantly longer or shorter than before, the IUD may have shifted and should be evaluated by a healthcare provider. A follow-up appointment is often scheduled a few weeks after insertion to confirm that the IUD remains in proper position and to address any concerns or side effects. Most women adjust well to their IUDs and experience few ongoing problems. IUDs are effective immediately if inserted during the first 7 days of the menstrual cycle. Otherwise, a backup method of contraception should be used for 7 days for hormonal IUDs or until the next period for copper IUDs, unless otherwise directed by the provider. IUDs provide long-term protection against pregnancy, anywhere from 3 to 10 years, depending on the type. They can be easily removed by a healthcare provider at any time, restoring fertility almost immediately. There is no evidence that IUDs cause infertility or harm future pregnancies, making them an excellent option for women seeking reversible contraception. In addition to pregnancy prevention, hormonal IUDs can also provide relief from heavy menstrual bleeding, reduce menstrual cramps, and even help manage certain gynecological conditions such as endometriosis or adenomyosis. Copper IUDs, which are hormone-free, offer a reliable choice for women who prefer or require non-hormonal contraception. The process of IUD insertion may seem intimidating at first, but with a skilled provider, thorough preparation, and clear communication, it is generally safe, quick, and well-tolerated. Understanding each step, from initial consultation to aftercare, can help demystify the experience and put patients at ease. For those considering an IUD, it's important to ask questions, discuss any concerns with a trusted healthcare provider, and make an informed choice based on individual needs and preferences. As with any medical procedure, having a clear idea of what to expect goes a long way toward ensuring a positive and empowering experience. In summary, IUD insertion is a straightforward outpatient procedure performed by trained OB/GYNs and other healthcare professionals. It involves careful preparation, gentle technique, and attentive aftercare to provide highly effective, long-lasting contraception. With the right information and support, most women find the process manageable and are pleased with the convenience and freedom an IUD offers. Whether seeking reliable birth control, lighter periods, or simply peace of mind, the IUD remains a valuable option in the spectrum of reproductive health.